Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome to another episode of the Keeping Ashland Healthy podcast. With me in the studio today is the one, the only Dr. Ashley Ackerman.
Good morning, David.
Good morning.
How are you today?
I'm doing well. I am the boss. I'm
Mr. David Ross,
that's
the
me.
Executive Director of the Mental Health and Recovery Board.
Yes, I'm here with Dr. Ashley, who's really the important person. And
No.
this podcast episode, we are excited to bring to the audience. This is about Elder Empowerment Month, and that is all through the month of June. And we wanted to take a moment on this episode to walk through some of the things that are available in the month of June in Ashland County, some of the partners that we work with, and also to spend just a little bit of time on elder abuse, which is it occurs on June 14th and 15th. Technically, June 15th is the actual World Elder Abuse Awareness Day. And some years ago, the Ashland County Older Adult Behavioral Health Coalition said, we want to recognize this particular day and this issue, but can't we maybe wrap around it some of the positive elements, some of the protective factors around that issue and kind of fill it out?
Yeah, I love that. So not just focusing on elder abuse, but some resilience of the older adult population and the positive things too. I like that a lot.
Yeah, and that is really something, one of the little things I've noticed since I've been working 20 plus years now in Ashland County. Mm-hmm. That is, it's something that is part of the Ashland mindset, if you will, is we do try to focus on positive strengths and resiliency, and I just love that about this community.
I do too, yeah. A lot of people might not know, you mentioned the Older Adult Behavioral Health Coalition of Ashland County.
Good point.
So they may not know that exists, but that group is a group of professionals locally that are really passionate about serving the seniors in Ashland County. And they put together this calendar in the month of June called the Elder Empowerment Month calendar that we're going to talk about today.
And this is all the things we're talking about because I don't want folks to feel like they're going to miss anything. We'll have this information, Dr. Ashley, on the Mental Health and Recovery Board's website.
Yes, it's there already.
Okay.
Yes.
And then I know you do some social media posts. And so wherever folks take, whether we're on Instagram, we're on
Facebook and LinkedIn.
Right. And
yes.
you said we're not on X. Is that correct?
We're not on X,
okay.
No, which is the new Twitter.
Yes.
We're not on there.
Okay.
And we don't have a TikTok. I'm sorry.
All right. There's a few things, folks. Sorry about that. But Dr. Ashley did not think that those mediums would be appropriate to my temperament.
Yeah. I think not. But we're on Facebook, and we will definitely have the calendar available there. Or you can go to our website, which is ashlandmhrb.org.
That sounds great. So let's jump into the calendar. And maybe, Dr. Ashley, if I forget, we can speak a little bit more about the Older Adult Behavioral Health Coalition at some point.
Yeah.
On June 3rd, which is a Monday, one of the first speakers is going to talk about blood pressure, glucose screenings, and that is going to be through the Sullivan Golden Center.
Yes.
Now, again, that gives me an opportunity to talk to the audience about what is a Golden Center? And a lot of people may not know this,
right.
But the Mental Health and Recovery Board for many, many years has funded multi-generational mentoring and Golden Center. It started in Loudonville, and it has grown. Denise Conrad with Catholic Charities, one of our contract partners, has really done a great job, as well as her boss, Cheryl Villegas, in spreading how important these Golden Centers are. They bring together seniors from the local community, local area, wherever they're held, and this is in the Sullivan area. Mm-hmm. She arranges for different speakers to come in to talk to the seniors about a variety of different subjects. And it gives them an opportunity to not only learn, but to socialize and to not be isolated. And to that we talk about this all the time about how being connected and active and engaging your mind and your emotions is so important for all of us, but particularly our seniors.
Yeah, and those are really fun. We've gone there
Yes.
before and talked ourselves, and the folks there really enjoy it. Like, it's kind of a fun thing, so.
So, in addition to all the other fun things they do, they are going to have a speaker there from Samaritan, and they're going to talk about blood pressure and glucose screenings. And I love this component of it because there is a definite link between primary health and behavioral health. So, we know for any of us, whether you're a senior or not, how you're doing physically will impact how you're doing mentally, emotionally, and vice versa.
Vice versa, absolutely. Yes, I'm glad you said that.
Yep.
And those blood pressure and glucose screenings are at no cost, so I think that's great.
Awesome.
Yes. So Tuesday the 4th, there's a webinar on the calendar. You can actually just click, if you go to our website, click on that day. It will link you to this webinar. Laura Brewer of Safe Haven, she did this presentation about healthy boundaries in later life.
Yes. So again, in keeping with the theme of World Elder Abuse Awareness Day, this idea of healthy boundaries in later life, I thought that was so interesting as a topic because, it's not, we do this talk with our adolescents and our young people.
Hopefully, yes.
So you might think, seniors don't need, but, what do you think some of the things that might come to your mind when we think about healthy boundaries in later life that you think they might touch on?
Right. Well, one of the things is like the shifting dynamics in families. So sometimes older adults are living with, their children.
Yeah.
That's common. And how do you set boundaries when you're living in the household with your children? The roles kind of change and dynamics change. So I think that's one of the things that she's going to talk about.
I think it's becoming more and more common too, these multi-generational families, again, grandparents and their children, and then the grandkids all together. And, how do you negotiate all that? And it can be challenging, especially we've seen this, Dr. Ashley, in this county, and other counties have seen it, when, especially when issues around substance use come up. So maybe son or daughter might be struggling with substance use. Grandma, grandpa are raising the grandkids for a while.
Right.
And then now their son or daughter is back into the picture. They're doing well in their recovery, and they're negotiating how do we get on with life given everything that happened in their previous role. How do they again transition to grandma grandpa role when they were kind of acting as parent role? So there's a lot of complexity with our relationships right now. So.
Yeah, and that's happening a lot.
Yep.
You hear a lot of that.
Absolutely. So that's a good one. On the 5th, so this would be Wednesday, June 5th, one of our other Golden Centers, the original, Loudonville, the OG Golden Center.
The OG, yes.
Yep. They're having a speaker from the Chamber of Commerce talk. So folks, our chamber is very, very active. In fact, the word on the street is they have their own podcast. So, on to make of that, Dr. Ashley.
The competitors.
Yeah, they might be competitors, but.
That's funny.
Yeah. So.
Yes, Loudonville Golden Center. Thursday the 6th, this is exciting. The SALT meeting takes place at 10 o'clock a.m., and that's always at the Sheriff's Annex.
And that'll give us a chance to talk about what is SALT.
Yeah, what is SALT? So SALT stands for Seniors and Law Enforcement Together.
Yep.
And you have a little more of the history of that.
Yeah, it was an initiative 9-10 years ago now that Ashland County jumped on right away. And I will say that had a lot to do with Sheriff Reisner and the Council on Aging director at the time, Peggy, and they wanted to do this immediately. So the sheriff partnered with us and has never stopped. He's had a deputy now probably, he's probably a lieutenant at this point. I can't remember. He started, I think he was, I don't know what his rank was, but he's moved up. He's Sims. He's been with us from the get-go.
He's great.
Yeah, he is. And but the idea was, how can law enforcement partner more intentionally with the seniors and their community so they can be that trusted resource so that they won't have any issues around contacting them, reaching out in terms of scams, fraud kinds of issues, which are unfortunately, Dr. Ashley, are really common. So that SALT meeting was part of that relationship building. They want to have a regular monthly meeting where law enforcement's presence, they give a brief update on things that they're noticing from their perspective. It gives the seniors a chance to talk to law enforcement, see them, establish that relationship, but then they also bring in outside speakers as well.
Yeah, and they do. We go to that meeting, and the seniors always have good questions for them.
Yeah.
I think it takes away a barrier so that they can communicate directly with law enforcement. That's great. So the speaker that day, on Thursday the 6th, is Noah, and he's there with Hospice of North Central Ohio.
Yeah, excited about Noah speaking. A lot of the folks in the listening audience know No Noah.
No, Noah. Yes,
Yeah.
Noah's great too.
Yep. Yep. So, and again, you've been to a SALT meeting if you've heard a joke from Alvin.
Oh, Alvin, yes. I wish I could tell one right now.
Right.
Should have had
He's
one
got
on
the
hand.
best granddad jokes.
They're the best.
Yeah.
Yes.
Friday the 7th, the Alzheimer's Association, another member of our Older Adult Behavioral Health Coalition, has an online video where they're going to be focusing on how to have a conversation with your doctor, which I
Yeah.
thought was very important and timely.
Nice. And practical tips of how to do that, because sometimes it can be kind of intimidating or you don't know how to go about that. So
Yep.
that's great.
Yeah, as this issue, I think for a lot of us, this is getting more and more personal. If you are staying in touch with grandparents or parents as they get older, unfortunately, this issue of Alzheimer's is more and more common, and we're all wrestling with it to some extent, both the individual affected as well as all the family and friends. So anything like this, I just encourage folks to take advantage of it. Typically, Alzheimer's is one of those things where it may happen over time, gradually. So knowing, kind of what to look for, what to listen for earlier on might put you in a better position and know the resources to respond.
Definitely. Yeah. That's a good one. And again, just a link so you can watch that at home. So that's great. Monday, June 10th, another Golden Center. This one will be at Mill Run. And the speaker that day is Kingston of Ashland.
Yeah. If you're keeping track at home, so we've talked about 3 Golden Centers so far: Sullivan, Loudonville, and now Mill Run.
Yes.
And then on the 11th, one of our long-time partners, Kaylee Bradley, she's with Refuge Counseling. She's been at a couple different agencies over the years, but she's currently with Refuge Counseling, which is her own practice her and her husband run. And she's going to talk about grief across the lifespan. And Kaylee, if you don't know, is an expert, one of our local experts on grief. She's done a lot of work in this space, and I know she has a heart for our seniors too. And there are so many different griefs I think our seniors experience, but those griefs, it does change across the lifetime. So I think she's going to talk about that, but it may not be what the audience thinks of. There's sometimes we can grieve our lack of health, our lack of connection, our lack of purpose, identity. If we're retired, there's a lot of different kinds of losses.
Yeah, so it's not always death. It can be just loss in any form. And I think Kaylee does a good job of that. I've actually watched that webinar, so I'd encourage you to watch that. That's a good one.
Yep.
The 12th. This is really exciting. On Wednesday, June 12th, there's a community event happening at one of the Loudonville Golden Center.
What's going on?
So at the Loudonville Library, 10 o'clock a.m., there are going to be several speakers there that day.
Oh, wow. I see the lineup here.
Yeah, it's a good lineup. So Dr. Dennis Keating is going to talk about Ohioans in the Civil War. They're also going to have the Ashland County Historical Society there, and they're speaking. Michael Johnson of Patriot Capital Financial is going to discuss the latest on Medicare scams and fraud. That's a big one. Yeah, we hear a lot about scams for older adults. The Area Agency on Aging is discussing staying in your home as you age and how to do that, how to stay home as long as you can. And then they're having a luncheon to follow at noon.
Yeah, that's great. So a couple hours of great content, multiple speakers. So that is June the 12th down at the Loudonville Golden Center, which is at the library down there in Loudonville. It's a beautiful library if you've not visited that. But yeah, we encourage folks to go to all these, but some of these events we particularly want to draw your attention to as June 12th. There's a lot of good content there, so encourage folks.
Fun.
Yep. On the 13th, the calendar, you'll see something that says self-care tip, make your favorite recipe. What is that all about?
Well, there was no actual event that day, and I thought, what could we put on there that would be something meaningful to older adults? Make your favorite recipe. I think
like that.
Yeah, I think that's a fun self-care thing you can do by yourself. You could do that with others. You could do it and reminisce, because food takes you back to a different time sometimes.
Yeah.
Right?
I like doing that. I'm brainstorming, Dr. Ashley. So for our seniors or anybody that wants to do the self-care tip, you do your favorite and maybe sit down with somebody that's done their favorite, 2 or 3 folk, and share. I think that would be fun. And maybe talk a little, unpack how you came by that recipe, how long that recipe has been in the family.
Yeah.
I'm with you. There's always, if it's a family recipe, something that's been done for a while, there's always a great history behind
Yeah.
like how it got to be a tradition, funny stories associated with making that. So yeah, I think that's a good self-care tip. I'm glad we included those kinds of things in the monthly calendar.
Yeah, I love that. The next one, Saturday, June 15th, and you mentioned this a little bit before, but June 15th is World Elder Abuse Awareness Day. So we're encouraging people to wear purple. That's
Okay.
a thing. So
And take a photo.
that would be great. Yeah, take a
Okay.
photo. Whether it's a lavender shirt or plum-colored pants, wearing purple is a simple yet powerful way to show solidarity for elders.
Right. And you've seen my purple lineup. I've got plenty of purple things.
Yeah, I need to work on that, though. I don't
Yeah.
have much purple. The importance of this day cannot be overstated. Studies reveal that as many as 1 in 10 older Americans suffer from some form of abuse, yet only a fraction of these cases ever reach the authorities. This lack of reporting highlights the need for greater awareness and action. So that's the importance of that day.
Yeah. And since, again, this is why we created this entire month full of activities and education, is to bring awareness to elder abuse. Let's take just a few moments here with the audience to talk through some of the signs of mistreatment.
Yes.
And maybe before we even do that, maybe, I hate to read, but an official elder abuse definition that folks might help ground our conversation as we talk about this, Dr. Ashley, is elder abuse is an intentional act or failure to act. So intentional act or failure to act that causes or creates a risk of harm to an older adult. Common types of elder mistreatment include physical, sexual, emotional or psychological, or financial abuse, neglect, or self-neglect. Elder abuse impacts people of all ages, identities, and backgrounds. So that's kind of I know that's wordy, but that's an official. But I like that definition because it's comprehensive. I think it's more than people would normally think of.
Absolutely. Yeah, it's a good definition to start with. So we want to go through some of the signs of mistreatment,
Yep.
things that might kind of indicate or, show that you might be worried if you notice these signs. So physical signs, dehydration or unusual weight loss, missing daily living aids like their glasses or walker or medication.
So if you notice that they typically wear glasses, they're hearing, and then all of a sudden okay.
They don't have them. Unexplained injuries, bruises, cuts, or sores.
Big one.
Yeah.
Yep. If you notice that with someone that you're caring for or you're with, ask that follow-up question. What's going on?
Yeah, what happened? Torn, stained, or bloody underclothing.
Absolutely.
Unattended medical needs, and unexplained sexually transmitted diseases.
Sure.
Those would all be red flags, definitely.
Definitely physical signs that could be, maybe not, but they could be signs of mistreatment.
Yes.
So emotional and behavioral signs. So in addition to physical signs, there are sometimes emotional or behavioral signs that might be an indicator of elder abuse. Things like increased fear or anxiety, where that wasn't present before, based on your knowledge of the individual. That isolation from friends or family, and I would particularly say if that's different out of the ordinary. If the person was always somewhat, in their history of knowing the person, they always were somewhat isolated or not a real people person, that's one thing. But if the person goes from being very, very socially active to not at all,
a sudden change. Yeah.
More concern.
Yes.
Unusual changes in sleep, and that behavior or sleep, that goes for any of us, but particularly for our seniors, that might be the thing causing those unusual changes, might be elder abuse. And then similarly, withdrawal from normal activity. So if this person was active in certain clubs, going to church, et cetera, and all of a sudden they're not going, could be a sign of elder abuse.
And it's important to key into those things,
Yep.
definitely. Financial signs might be fraudulent signatures on financial documents. Does someone else sign their paperwork?
Right.
Unusual or sudden changes in spending patterns. So maybe they spend a bunch of money. That would be abnormal for them. That would be concerning.
Right.
Or bills going unpaid.
Right. I mean, and this gets so complicated because it could be abuse, but as we talked about before, it could be more cognitively based things going on with the Alzheimer's, where just the person maybe not able to manage the finances in the same way they did before.
Yeah.
But again, I think the key, Dr. Ashley, is to ask the follow-up questions.
Yeah.
Notice, understand that, I shouldn't just let this pass. I need to ask that follow-up question, ask it in a respectful way, but ask it.
Yeah. And I think for that to happen, you have to be connected. Right. So staying connected to the older adults in your life is super important. And then you would notice those changes if they were happening. So,
Yep.
yeah.
And these signs, it's a publication by the National Center on Elder Abuse, and we can make this available to folks
Yeah.
if they go to the website as well.
Yes.
Yep.
And then we have some more information, 5 things everyone can do to prevent elder abuse. I think that's really important to go over also.
Absolutely.
1, learn the signs that we just went over.
Yep.
Learn the signs of elder abuse and how we can solve the issue together.
Yep. Prevent isolation. Call or visit your older loved one and ask how they're doing on a regular basis.
Yeah.
So, I mean, just make a point of it. If you know somebody in your church or in your community, in your family, that you know that their situation is such that they're living by themselves, make it a point to call or visit.
Yeah. Talk to friends and family members about how we can all age well and reduce abuse with programs and services like law enforcement, community centers, and public transportation.
Yep. Sign up to be a friendly visitor to an older person in our communities. And again, you can do this through several organizations, but the whole idea is that we want to reduce that isolation and that lack of connection. So find a program that makes sense, like our Golden Centers or our MGM programs, or maybe your local church, to visit some of our, the old term, Dr. Ashley, you may not know this term, the old term was shut-ins.
Shut-ins, I
I don't know
that.
if they still use that term, but at least at our church, we would know the folks that, because of maybe driving, physical, other reasons, that they spend a lot of time in their home. So we went to them. We went and brought them things, talked, spent some time. But and I can tell you, that's a very rewarding use of your time, because you end up helping yourself more than you really think you are, but you're certainly helping the other person as well.
Yeah, I know a lot of churches still do like shut-in trays where they take food and things like that and visit them. So that's nice. And the last one, send a letter to a local paper, radio, or TV station suggesting that they cover World Elder Abuse Awareness Day, which we talked about is June 15th. Or just get involved with World Elder Abuse Awareness Day. Help us spread the word.
Yeah.
So.
One of the things I like about this sheet is they have a tagline that's similar to our suicide prevention tagline, and it is up to all of us to prevent and address elder abuse. And I think that's right on. I mean, it's not somebody else's thing to do. It's
somebody has to do that. Yeah, Everyone can.
It is, as you like to say, Dr. Ashley, it's the human thing to do.
It's the human thing.
And we're all humans.
Man, it's catching on. It's catching on.
Well, that is June 15th is the World Elder Abuse Awareness Day. It's why we're doing this whole calendar, this whole month of things, is to raise awareness, but also to build resilience and connection. And again, on the 17th, which is a Monday, we've got another webinar with Kaylee Bradley. She's going to talk about permission to grieve. And believe it or not everybody recognizes that it's okay to be sad.
Absolutely.
When you lose a friend, a family member, or again, some of those other losses we talked about.
Yeah. And there's not something wrong with you because you're grieving. Like, that's normal. Tuesday, the 18th, Martin House is having the Golden Center. The speaker that day will be Brethren Care.
Excellent. And then we're back to the Loudonville Golden Center on the 19th. If you haven't noticed the pattern here, Dr. Ashley, the Loudonville Golden Center meets every Wednesday. Wednesday the 19th is no exception. The Olivesburg General Store is going to be their speaker that day. And word on the street, they got a mean pizza pie there.
Oh, really? I hadn't heard that.
I've heard it's really good.
I bet that's going to be a fun Golden Center.
I think so.
And then Thursday the 20th at 1 o'clock p.m., the Council on Aging is having their caregiver support group.
Yeah. And I think the nice part about Council on Aging, I think they have the space that the person that you're caring for can actually be there too, engaged in other things, while the caregivers are also getting some support through their group.
I think that's great.
Yep. And caregivers, as we know, that is it's a challenging situation to be in. Obviously, you care about your loved one. You've got your own things going on. But sometimes you just don't know how to best handle some of the situations. So oftentimes we can learn better from other people that are in similar situations, sharing, hey, tips. This, it sounds like your mom or dad or your uncle, aunt, whatever, might be, going through something similar. I've been through that. This is what worked. Maybe give it a try. So to practical things like that, to just saying, you know what you're going through sounds hard. Just acknowledging that it's challenging.
I'm sure that's helpful to have other people that are going through it.
I think so.
Friday the 21st, another self-care tip.
Self-care tip, what is this one?
Call an old friend and see how they're doing.
Wow. Okay.
It seems like a simple thing, but I think, that can go a long way, and not a lot of people do that anymore.
Yeah.
So you're text messaging and things like that. Give them a call. Actually talk to an old friend that you need to connect with, I like that.
Give them a ring, hopefully on a corded phone. That would be awesome.
That would be really
Right?
cool.
Monday, the 24th. Yeah, self-care tip. You can only call them on a corded phone.
I like the ones, remember the ones you had to dial?
Yes, a rotary dial.
Is that what it was called?
It was a rotary dial, yes.
Those were great.
Yeah, not the push button. Push button, that was space age. I'm talking rotary.
Yeah, that's the best.
Monday the 24th, the Mill Run Golden Center is having Martin House talk about their assisted living.
Yes. Tuesday the 25th, Hayesville Golden Center. They're having Mary's Insurance as their speaker that day.
Okay. And then we're back at the Golden Center in Loudonville on Wednesday the 26th, and Brethren Care will be talking again.
Yeah, another opportunity to talk with Brethren Care.
And I don't know if you've been by, I call it a campus. It really is a campus. Brethren Care has several different levels of care within their operational control, and there really is a different level of care from more independent, less independent. They've got a lot. So I think it would be interesting to see all the different things that are available there for folks that may not know that.
Definitely. Thursday the 27th, another webinar with Kaylee Bradley of Refuge Counseling, and this one is on Medicare advocacy efforts.
Well, I'll tell you, a lot of folks on Medicare. It's an important, big program, but it is confusing. Actually, I've tried to help my mother with some of this stuff. I mean, it takes a team to understand Medicare.
Absolutely. And that one specifically, I know she's talking about the recent changes where counselors can see clients on Medicare.
Oh.
And that was not a thing prior to this year. So I know she talks about that because she's a counselor herself.
Sure.
So, yeah.
And then last but not least, Friday, June 28th. Uh-oh.
This sounds fun.
I have played this before. Play Uno at the Council on Aging, 9:30 a.m. So if you are an Uno player.
Do you have to be a senior citizen?
I think we can go down for that one.
I want to.
I think we should go, Dr. Ashland.
That would be really fun, actually.
But hopefully, if folks haven't played Uno before, hopefully everybody in the audience has played that. Well, it's a fun game because it inevitably leads to discussion, laughter, fun, engagement. It's really hard to play Uno without having a good time.
It's a good time. It's pretty simple, It's a good time.
Yep. And I think that is a wonderful lineup for the month of June. So again, this is the Elder Empowerment Month in Ashland County, Ohio. This is something that has been we've been doing for several years now. It really is all around World Elder Abuse Awareness Day, which is on the 15th. We wanted to construct other things that are going on that entire month that builds elder empowerment. The Older Adult Behavioral Health Coalition was vital in putting this together. And again, as Dr. Ashley said, this is just a group of Ashland County agencies or regional agencies that come together regularly to talk about how can we better serve our seniors in Ashland County. We've been meeting for over 17 years, believe it or not, Dr. Ashley, but with the changing demographics that most of us have read about, we know that our seniors are going to continue to increase in numbers and needs, and our workforce and our programs and our services, we got to keep up with them or else we're in trouble.
Absolutely.
They have needs, and we want to meet those, and they have emerging needs, so we have to listen to them so that we can hear exactly how they want to be served. And one of those ways we'll talk about, one of the events was, living in your own home for as long as you want to live in your own home. So how can we help them do that? If that's something they want to do, how can we keep them as independent and living in their own environment as they want? So lots of stuff through this month.
I just want to say, too, so we will have the calendar, which has everything that we talked about today, but also there's a second page to that has the details about those events. And
Great.
So if you're wondering where or what time or any of that, that will be available along with the calendar.
Well, that sounds good.
Yeah.
Well, Dr. Ashley, I appreciate you taking some time out with me to inform the public about this important month of June. So, listening to audience, I hope that you can get this information. If you're not the right person, please send it to somebody. But we want to draw attention to the important issue of elder abuse, but we beyond that, we just want to empower our seniors to let them
Yeah.
know we care about them, and there's a variety of things available in Ashland County, not just in the month of June, throughout
Always.
the year.
Yeah,
Right.
and we care about our seniors. So
Thank you, Dr. Ashley.
thank you.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.